Today I'm going to talk about how to monitor your blood glucose level. Today we're going to use a commercially purchased blood glucometer, basically out of any Walgreens or CVS. This one we're going to use today is the Precision Extra. Alright, basically the glucometer is this little machine right here. The accessories that come with it, you're going to have test strips, which come in a foil package. You're going to have a Lancet device that it comes with. That's in order to get the blood sample. Okay, you have a book that comes with it. Step-by-step instructions that tell you how to use the equipment properly and what to do to troubleshoot if there's any problems. In order to prepare to use your glucometer, you're going to need some supplies, a 4x4, a Band-Aid, a alcohol prep, and your Lancet that goes inside the lancing device. That's how you are able to get the blood drawn out of your skin. Okay, the first thing you're going to do in order to prepare your glucometer to work is you're going to use the calibration strip to make sure that your machine is calibrated for the test strips that you're going to be using. So this calibration device is set for lot number 45001. These test strips, or 45001. Also, you want to check the expiration date, make sure that they're not expired. Okay, so there's a lot of preparation you're going to do before you actually test your blood sugar. Alright, first thing, you want to be familiar with how the machine works. Here is the on and off button. Okay, the display screen, these are the forward and back arrows. This is where the test strip is inserted. On the side here is a backlight, so you can light up the screen to see it a little easier. On the back, this is battery powered. Has a small little battery in the back. So if your machine is not working, you want to make sure that you check and make sure that your battery is functioning. Alright, when you turn on your device, you're going to press the power button. You should get the screen to light up. Alright, it had all kinds of different things that lit up. You want to make sure that the screen is working. Okay, so the first thing you're going to do, take your calibration strip. You're going to insert it into the machine to make sure that it knows which calibration going to be set to which lot number of calibration strips you're going to use. So right here is set for 45001, test strips 45001. So these are compatible, it has been calibrated. Alright, so you want to have all your materials prepared. You have your gauze, you have your alcohol prep, you have your lancing device, you have your Lancet, you have your glucometer. Alright, the next step is poking for the blood draw. If you're a healthcare provider, obviously you want to put on some gloves, make sure we have PPE available. Okay, I'm going to be doing this to myself, so no gloves for me. Okay. First thing we're going to do is we're going to prepare the site. We're going to take our alcohol prep pad. We're going to clean up the site. Make sure the site is dry because the alcohol will give you a false reading. Make sure that it just air dries. You don't want to wipe it with something. You don't want to contaminate what you've already cleaned. Okay, you want to have your Band-Aid and your 4x4 handy. So after you do get the blood, you don't want them to be bleeding all over the place. The Lancet device itself has a dial which can control the depth. This one is currently set at 4. It goes from 1 to 8 on this lancing device. 1 to 2 is for very thin, fragile, delicate skin. 3, 4, and 5 is your average normal skin. It's going to penetrate and get the blood sample. If you have really thick skin, callous skin, hands that are very rough and harder to penetrate, you're going to put it up to the higher setting 7 or 8. Okay, so we're going to take our test strip, take it out of the foil package. We're going to insert the strip, black side, into the machine, face up. When you do so, it will turn on the machine. You'll go through your screen, alright, and then it will give you a signal that it's awaiting a drop of blood. We've cleaned our site. We have our Lancet device. We're going to insert the lancet into the device. We're going to remove the cap, and we do have an exposed sharp right here. Very tiny, very small. Oh, needle. Alright, we're going to replace our cap. We've depressed the plunger. You're going to engage it, and this is what you're going to use to deploy the needle into this tissue. Alright, since I've touched everything again, we're going to clean off the site one more time. Alright, so we're going to alcohol prep my finger one more time. Clean it. Wait for it to dry. Air dry, no wiping. Okay, moment of truth. Alright, usually the side of the finger is a little less painful. Oh boy. Not that bad, I'm kidding. Alright, so you're going to see a little drop of blood starting to form. You can take your little 4x4, you can wipe that drop of blood, then you can milk the finger a little bit. Milk the finger until you get that drop of blood coming out there. Alright, we got a nice little drop. The machine is waiting for that drop of blood. We're going to set that strip right next to the finger till it absorbs your hair beep. Alright, we're going to hold pressure on the finger with our 4x4. 5 seconds, we should get a reading, 129. This had M&Ms. So usually normal blood glucose level is anything between 60 and 120. Okay, depending on fasting, whether you've eaten or not. Okay, then all you want to do, obviously there's blood on the end of that glucometer strip. I'm using a 4x4, you're just trying to keep the exposure to a minimum. Also, your lancing device is now sharp. It's contaminated. You don't want to reuse this. You don't want to use it on somebody else. So what we'll do is we'll take it out of the machine. You can put it in a container, like a detergent container, a milk jug, some hard plastic container. If you do have a Sharps container available, obviously, that would be the most ideal. Okay, after that, you're going to make sure you give your patient a Band-Aid, or if it is yourself, put a Band-Aid on it so that it does not bleed. Okay, disposing of the Sharp and the lancet, you're going to remove the cover. Okay, you're going to pull out, and you're going to dispose. Okay, so reviewing, you want to make sure that you have got your supplies and equipment, you have calibrated your machine, you know how it works, turning it on and off, how to insert the glucometer strip, how to use the glucometer strip calibrating device if you use a different set of test strips from a different box. Each time you use a box, make sure that it's calibrated to the calibrating stick that it comes in the package, and make sure that if you're giving yourself monitoring your blood glucose, you can keep a log. This has a memory to it, so if we turn this back on, we can go back. Once it comes on, it memorizes, and you can scroll back through if there's any more and go back to. So that's the only one we've done so far. So it will keep a 7 or 14 or 30-day calendar depending on what you set. So it is important to monitor blood glucose on a regular basis, especially if you're diabetic, because too much sugar in the blood, called hyperglycemia, can cause detrimental health effects. Too low blood sugar can cause hypoglycemia, which causes people to act stuporous. They may act like they're drunk, altered, or maybe even people mistake it for people having strokes. So it's important for people to know what their blood sugar is, know what the levels are, and how to monitor it properly.